I did my pre-medical studies in Ghana, as well as my medical degree. So initial 3 years of human biology I did in Ghana, and then subsequently did 3 years of primarily medicine and surgery. Graduated in 2003. And then afterwards I ended up, going back to my medical education, I had to do a number of rotations, which I did in UK, London, including plastic surgery and medicine. And then I decided to go into pediatrics, and that was mainly because I had significant interest in pediatrics during my medical school training. And so in pediatrics, I went to Chicago Mount Sinai Hospital, Sinai Children's Hospital, and I spent 3 years there doing general pediatrics. And that's where I developed an interest in pediatric GI. That's when I spent so much time with my attending physician. Just really loved GI. And I was fortunate to get accepted in New Orleans, LSU, by one of the world-renowned gastroenterologists, Dr. Paul Hyman. And I spent 3 years there, really enjoyed myself. I enjoyed GI. And so once I completed, I came to Shreveport, practiced for about 6 years, and then went back to school, went back to doing an advanced therapeutic endoscopy fellowship. Pediatric GI physician sees patients from early infancy or neonates from day one, all the way to, late teenage years, 19, 20. I mean, there are times where we see kids even after the age of 20, maybe early adulthood. And basically, we see patients with abdominal pain. And when we talk about GI issues, that's any pathology or disorder that involves the gastrointestinal tract, which is the esophagus, the stomach, the small intestines, which is the duodenum, jejunum, ileum, and then the colon. So any kind of pathology within the GI tract. GI is not just a diagnostic specialty. We also offer, endoscopic therapies, right? And so that's always been my interest, and that's part of the reason I went back to do the advanced endoscopy and therapeutic fellowship. Currently, my main interest is pancreaticobiliary, and so the gallbladder, the common bile duct, and so that's primarily my interest. And so I see patients, or I love to see patients with this kind of pathology and provide them some help. I approach every individual as an individual, and try to maintain that. I mean, even though pathology can be about the same, and that's part of the reason we love what we do, because, once you speak to one patient, two patients, they have the same symptoms, you're able to figure out what may be going on. But because they're different, I approach it that way. And I like to be very clear and very precise. I like to be very detailed, in my conversation with patients and their parents, making sure that I have all the information that is needed to kind of make a diagnosis and come up with a plan of management. I like to make sure my patients feel very much at ease, when they come in and see me. And so I mean, in short, I would say that I approach every patient as an individual, you know, and keep in mind their background and you know, and whatever situation they have, and you know, and that's the way I approach things.